how does orthodontics and the dental insurance policy world come together? What's the deal with all that? So if you have a dental insurance policy, you're gonna have two buckets. You're gonna have the dental bucket that's gonna be for all your dental stuff, and that resets usually every year. And then you're gonna have an orthodontics bucket that is just a lifetime benefit that you get to use only once. So usually that'll be $1,000, $1,500, $2,000, something like that. Something on that level is what most people tend to have in their orthodontic coverage under their dental policy. So then the question is, how do I best utilize that coverage? You want to find an orthodontist that's willing to send the bill to the insurance companies. And sometimes orthodontists will use something called assignment of benefits, where they tell the insurance company, this patient has assigned that benefit to me. The orthodontist files the claim, and then the money comes to the orthodontist, and we know that in advance. Or there's some orthodontists that don't do assignment of benefits, where they just file the claim for the patient, the money goes to the patient, and then the patient pays the office separately. You know, it doesn't really matter one way or another. It's just a matter of how the individual practice kind of organizes their finances. If you have a PPO dental insurance plan, what happens when you go to an out-of-network orthodontist? 98% of the time, your coverage will be the same at the in-network and the out-of-network orthodontist. If you have $1,500 worth of coverage, the in-network orthodontist can help you get that $1,500. The out-of-network orthodontist can do the exact same thing. It doesn't matter if you go to an in-network or out-of-network orthodontist, because in both cases, you'll be able to utilize the full benefit. The only difference is that if you go to an in-network orthodontist, that in-network orthodontist has already pre-contracted the treatment fee with your insurance company. The reason why that's not a good thing for your child is because you have the insurance company dictating the value and the cost of your treatment. Ultimately, it should be the orthodontist looking at and determining how complex the treatment is in the situation that needs to be treated, how long is it going to take, and then providing a cost based on the actual need that your child has, not based off of what an insurance company thinks it should cost.